Dr. Omer Awan. Great to see you. Good morning.
Good morning, Anna.
Let's first hit on this latest death that Xavier just mentioned and brought up for us there. So many parents are now worried for their young children. Is the MMR vaccine, is it the most effective way to stop measles?
It's absolutely the most effective way to stop measles. And quite frankly, it's the only way that we can stop measles. Getting 2 shots of the MMR vaccine provides 97% protection against measles. That essentially means you're not going to get measles if you get vaccinated. And certainly you're not going to be hospitalized, and you certainly won't die from getting it. Remember, all 3 cases of deaths were in unvaccinated individuals. Unvaccinated individuals. I think that's a really important point for the public and for parents to understand going forward, that we have to be inspired, and hopefully parents are inspired to vaccinate their children going forward.
And I will say this does seem to be the most robust endorsement I've seen from RFK about getting the MMR vaccine for kids and others as well. Let's talk a little bit about this Make America Healthy Again tour. I mean, this is pretty cool. He's taking things on the road. He's trying to end chronic disease in America. What do you hope to hear from RFK?
Well, I think it's great overall. I think one of the major initiatives for the Make America Healthy Again tour is to decrease the burden of chronic medical conditions, as you stated. And I think part of the things that he's celebrating is, these bans on ultra-processed foods, synthetic food dyes. And this is important because ultra-processed foods are high in fat, low in nutritional content, and they can lead to obesity. And we know in America, nearly 1 in 5 children are obese, nearly 3 in 4 adults are obese, and obesity leads to chronic medical conditions, things like heart disease, diabetes, high blood pressure, high cholesterol. So, hopefully I think he's going to make a dent in some of these chronic medical diseases that Americans have suffered for way too long.
Yeah, and when you take a look at the way America stacks up to the rest of the world, the amount of money that we spend on healthcare and then the negative outcomes that we have, how can we try to catch up with the rest of the world? And is RFK the guy to do it?
Well, certainly he's shown promise. I mean, we've already seen a Red 3 ban, and that's obviously that's positive. Synthetic dyes can be associated with things like, developmental and behavioral abnormalities in kids, things like inattention and things like hyperactivity, and even in animal studies, cancer. So I think it's a positive move going forward. I think the more people understand that they have to take care of themselves through diet, exercise, and be vigilant about it, we will start to see change. So I think this is a first good step, but there's obviously a lot more to be done, Anna.
I've been covering a lot of these MAHA type stories, and one of the top headlines is about this GRAS system, generally recognized as safe, and it essentially is allowing these big food corporations to self-police the ingredients that they're putting in our food in some cases. Do you think this is one of the biggest storylines of 2025, and do you think that system is going to be blown up by RFK?
I would hope so. And I think, there's a major discrepancy for how drugs are accepted and approved by the FDA and how foods are accepted. And remember, drugs move a lot quicker because pharmaceutical industries and big pharma helps fund that approval. Whereas for foods, it's mainly through taxpayer dollars, and that can really stunt the time where, foods are approved. So we'll see what RFK can do about this and see if there's real change that occurs. But yes, I think this is a major story for 2025.
Yeah, it feels like a real flashpoint. He is coming under a lot of scrutiny for cutting so many jobs, or Doge cutting so many jobs, when he's saying that he wants more research and more science and more testing to be done. But we're watching jobs be on the chopping block here. So we'll see how he is able to give us some clarity this week on his MAHA tour. Dr. Omer Awan, thanks for joining us today.
My pleasure. Thanks, Anna.
34 minutes.